I'm very excited to have the opportunity to moderate today's panel. During our discussion, we will explore how lions, LEOs, and the UN are making an impact in the area of global health and how every one of us can make an impact. Before we begin, I would like to share a little bit about what the Lions of Iceland, my country, have been doing to make an impact on mental and emotional health during the pandemic. When the quarantine started, everyone was isolated. We saw how it was impacting people, especially those living in home for elderly, who could no longer contact their families or have any visits, completely isolated. So almost every Lions Club in the country, in Iceland, bought iPads to give to the homes for the elderly in their own community. And the nurses and the staff of the homes helped the residents to learn to use it. And then the people could contact their families virtually, communicate with their grandchildren. We continued, it changed a lot for them. And so we continued to support the people in these homes. And during the past 2 Christmas seasons in COVID, in pandemic, in isolation, the clubs all over the country, we asked some of the local companies to donate gifts for the elderly that we could then wrap with the Lions logo, and gave it to them along with entertainment and music. We visited them, but we were not allowed to go in. So we were standing in the garden and the residents was on the balcony. And I participated in some of these events. We were like 20, 30 lions with their families, and all of us wearing red Santa hats and entertaining the elderly people. Yes, of course, my grandchildren were with me, as you know me. And yeah, we were singing for them, and they sang along. It was very pleasant. And then we had Santa to come and bring the gifts, bags full of gifts, and give it to them. We have continued to entertain the people in this isolation in a similar way. You come and sing and bring gifts during important events during the Icelandic year, the Independence Day and the first day of summer and such wonderful occasions. And I believe that service that addresses mental and emotional health is very important, and that when we serve from the heart, we are automatically improving the emotional health of those we serve, as well as our own. It's now my pleasure to introduce to you our distinguished panelists. Sitting next to me is Past Director Gary Anderson of Michigan, a doctor of optometry in private practice for more than 40 years. He has led and participated in 39 Lions Vision missions to Mexico, the Caribbean, Central and South America, and India. He has also served on the Michigan Eye Bank board and as a board president of the Association for the Blind and Visually Impaired. He's currently a member of the KidSight USA Board of Directors and a Lions Board appointee on the Service Activity Committee. From here in New York, we have Past Director Gary F. Brown. Past Director Brown works in the field of investment management and is currently an independent contractor. He became a Lion in 1984. He is a certified diabetes paraprofessional, and over the last few years, he has worked to help categorize Lions' efforts to combat diabetes in the field of the need of the Lion clubs, districts, and multiple districts. Joining us from Illinois, we have past District Governor Tony Holland, a service administrator at a heavy equipment dealership in Iowa. PDD Holland is a dedicated husband and a father of 2 children. He was inspired by his family's experience at St. Jude Children's Research Hospital to lead a service project to improve education and recreation for patients and families at St. Jude. With a grant from LCIF, he and his fellow Lions were able to provide the outpatient and inpatient clinics with iPads, gaming system, laptops, sensory and wall activity boards, and educational dolls designed to help patients and families process this difficult time in their lives. Welcome. And finally, we welcome Felipe, Queipo, Communications Officers of the Civil Society and Advocacy Section of the UN Department of Global Communications. Mr. Queipo is responsible for outreach, engagement, and global communications with civil society for the UN's Department of Global Communications. He often speaks to groups about civil society and public diplomacy, the role of youth in the international arena, and the Sustainable Development Goals, or SDGs. He's also the focal point for technology and social media platforms in the civil society unit in DGC. In this capacity, he assists civil society organizations in developing media policies and strategies to increase the efficacy of their outreach efforts to support the United Nations. Welcome. Gentlemen, thank you for being with us today. I would like to start off with a question to our UN representative, Mr. Queipo. In your work, you speak to civil society, which is to say, society outside of government and business. What is the role of civil society, and in particular NGOs, when it comes to the global health and well-being of others?
Wow. Well, thank you for the invitation. Thank you for being here, and thank you, Gudrun, for the introduction. You can hear me fine? Good. Civil society has been fundamental in the work of the United Nations from the beginning, from the inception. We cannot think of a UN without civil society. We cannot think of a stronger partnership or real implementers. I often say that expecting that the roughly 50,000 employees that the UN may have trying to service almost 8 billion people on this planet is very naive. We rely heavily on partners on the ground who know what they're doing, who are really aware of the situation, who really know the realities of the need of the people. New York, headquarters of the United Nations, is a good institution to convene people, but it's like a watchtower. We don't know what's going on the ground many, many times. We rely on good partners. Lions is one of the strongest partners we have in many aspects of the work that we do. Global health has to be, and it is, in fact, of the SDGs that you have, SDG 3, access to good quality global health, is fundamental, is one of the foundations for the work that we do. Lions Partnership and the work we do with you has allowed for the improvement of quality of life of many people. And just like we work with Lions, we work with many other organizations. My department has currently 1,566 CSOs we work with, and that is a tiny, tiny fraction. Allow me to say the US alone has over 1 million 501c3s registered. Just the US has over 1 million nonprofit and tax exempt organizations under one of the 29 different categories of the IRS for tax exemption. We work only with 1,566 from all over the world. And it's not because we don't want to, it's because we don't have the capacity, but we keep expanding. Lions, as I said, is one of them. So in order to be able to achieve our goals, in order to be able to service the people that we care for, it is imperative that we do it with civil society. Without you, as I said, it would be impossible for the UN, and my Undersecretary General today, Melissa, indicated that.
Big role.
Yeah.
Follow-up for Mr. Queipo. Although Lions and Leos serve in countless ways in their communities, we as an association have 5 global causes that align well with the UN's 17 Sustainable Development Goals. How can and why should we as UN partners look at the SDGs as we serve our communities?
Well, allow me to call them the Sustainable Development Goals that belong to the people. They're not the UN Sustainable. We know that they are referred to like that, but they belong to everyone. And a little bit of history, because it was mentioned today. The Human Environment Report 50 years ago in Stockholm in 1972 was the beginning of the concept of sustainable development as we know it today. The impact of humanity on the environment and how we can improve the quality of life of people. Throughout the last 50 years, and since the creation of the UN 76 years ago, we have been evolving, and we have seen that the service that we need to provide go beyond this peace and security concept. Important, but something like peace, the definition of peace has changed tremendously. The world in 1945 is a very different world that we have today in 2022. Back then, peace was, I don't get shot at, I don't get bombed at, and I'm okay. Today is quality of education, quality and access to resources, clean energy, and so on. The SDGs are a reflection of a consultation process that we did globally. And this consultation process came with an agenda, Agenda 2030, or Transforming Our World, and then 17 goals that are a reflection of what are the most imperative needs of society today, and achievable goals. People ask me often, can we really achieve the goals by 2030? If I did not believe that, I would not be working for the United Nations. I would be working somewhere else, because I really believe that what we are doing really can be achieved. The question is, do we have the willingness? Are people willing to? We have the means. We are the first generation in history to eradicate extreme poverty, to really achieve all the goals. But do we have the commitment of the member states? And for that, we need you. Again, going back to the civil society support, you monitor, you keep check on member states. You're the ones that, hey, you're not following what you promised to do in 2015. What are you going to do about this? How can we help? You are truly implementers of this. So I think that it is a roadmap that is not exclusive to the UN because we didn't create it. We convene people to create it as part of your goals because you created those goals. And what we hope is that we can help you coordinate with other entities so that we can together do it.
There you go. The 70 goals are our goals. Past Director Anderson, Brother Gary. Through Kids at USA, you work with your fellow Lions to provide eye screenings to ensure children can attain academic and social success. How have you been able to continue these efforts during the pandemic? And have you been able to reach the same number of children as you did before?
Thank you, Gudrun. Great question. I think most everybody in the room knows that 1925, Helen Keller challenged us Lions to be the Knights for the blind and visually impaired. It was a great challenge. For 90 years, Lions have provided vision care for the world, for those with visual disabilities. But in those 90 years, there was an area that we missed, that was overlooked, and that is the 6-month-old to 6-year-olds, okay? So why is that important? Well, 6 months to 6 years, if somebody has a very different prescription in each eye, they'll depend on one eye and not the other eye, and they can develop a lazy eye, amblyopia. If that's not treated by 7 years old, that can become permanent. 80% of what's taught in school today is presented visually. And if they're having difficulty seeing it, or they're working very hard in order to see it, they're going to be very efficient, and they might think that they have other difficulties, and it's simply a vision problem. Looking at that, in 2014, past International Director Dr. Ed Cordes and past Lions Club International Executive Administrator Peter Lynch said, how can we fix this? What can we do as Lions? And they put together a committee and developed Lions KidSight USA. The goal of Lions KidSite USA was to provide screening for 6-month-old to 12th grade students. And we talk about screening. This is a comprehensive screening that is not just an eye chart on the wall, because that's not a legitimate full-time screening or comprehensive screening. So there was 2 devices that were approved, and these are digital devices plus optics and spot, where a person can hold that device. It shoots an infrared beam into the patient's eyes, and infrared doesn't do any damage. Ultraviolet does the damage. So infrared beam shoots in the eye, measures as the beam comes back out, and it can measure very, very closely the amount of prescription that is in each eye, whether the eyes line up, and the pupil size. Those are all important because we can tell if the eyes are balanced in prescription, how much prescription is there, if they're misaligned, or if there's different pupil sizes, that can be a medical problem. So the machine will just register pass or fail. And so what's beautiful with that is anybody can run the machines, anybody can do the screening. You don't have to be an eye doctor, you don't have to have any medical training, and so any person, any line can be involved in the screening. So the pass-fail, those that are referred, the ones that fail are referred for a full eye exam, and again, 80% of those referrals are just fixed with a pair of glasses. Okay, the other ones might have a medical or some other work that they need done with their eyes. So the numbers are 2014, the first year, we had 500,000 vision screenings in the United States. 2019 to 20, 2 million. Out of that, there was a 12% referral rate, so that was 240,000 referrals from those screenings. Then we get to the pandemic, 2021. We did very, very few. Why? Schools were shut down, we couldn't do anything, all the requirements, all the necessities of doing the screenings were limited. So in 2021, KidSite came up with the idea of Project See Clearly Back to School. What can we do to enthuse in our Lions clubs? What can we get back to do the screenings again? So we came up with a list of COVID guidelines for the clubs. These guidelines, some were as simple as disinfecting, spacing, how to use PPE properly in terms of running the screening. And the clubs, what do? They innovated. A couple just tremendous things were they put up plexiglass. Like, you know, when I go to the bank now and I've still got the plexiglass thing in front of me, well, our devices will shoot through the plexiglass and it doesn't impair them at all. So we could have the students on one side and use the machine on the other side and get completely accurate readings on that. And the other was even better. We did drive-through vision screenings, okay? Clubs did drive-through food pickups, but we did drive-through vision screenings where they would put a tent up out in a parking lot to cover the light because we can't have too much light because that affects the pupil. And families would drive up and you could do that with the proper PPE on, run the device. If they were referred, they went in the left lane. If they passed, they went in the right lane and went home. And it was incredible. So in the 8-month period from July of 2021 till the end of February here, we did 533,000 screenings. And I shouldn't say we, you did, the Lions did that. And they innovated, and that would be the equivalent of 800,000 vision screening for a year. There was a 15% referral rate. And why the higher referral rate? So many kids are home doing a lot of screen time, which causes more nearsightedness and all of that. So we're finding more difficulties, making more referrals. And today, KidSite is being performed in 12 countries around the world. So Lions picked it up and have adapted.
Yeah, Lions are creative. They find ways to serve. So I would like Pastor Brown, similarly, I'd like to know how the pandemic affected your efforts when it comes to your work to combat diabetes.
It did not help, that's for sure. One of the things that we found is when we left here the last time, all of a sudden the world came to an end and the way that we dealt with it came to an end. Our Lions clubs went to sleep, a lot of them, and a lot of the people who were certified diabetes educators, educator nurses, ended up having another job. Their job was to go out in the lobby and give shots. So everything's separated, although we had a wonderful idea to begin with. What we did know is that in the United States, about 11% of the population has diabetes, but we also found out that a very high percentage of them don't know it. And when we said that this was something that we wanted to be one of our initiatives, we thought the best way to approach it was to provide diabetes self-management, education, training, and support. In the diabetes community, they love to call that DSMT. In fact, there's a bill on the floor of Congress right now labeled that way for diabetes self-management training in the 10-hour rule, which we could talk about a little bit later. But to do that, we had to, I hate this word, I hear it on the business channels all the time, pivot. I still don't like it, unless it's in a basketball game. But one of the things we did do is we decided to take the time and to use the time to develop our partnerships. Because we think these partnerships are critical going forward. In the partnerships, what we found is we are the boots on the ground for the certified diabetes educators, the doctors, the nurses, the people, the dietitians who go face to face with people with diabetes every day and want more opportunities to get to talk to them, but don't get those opportunities. One of them is because insurance doesn't reimburse enough. So we decided one of the things we could do is to put those people together in a room or have availability to resources that they could then bring their expertise to bear with our communities. So we did that. We went out, we have a partnership already with the International Diabetes Federation. We took this time to further and develop our partnership with the Association of Diabetes Care and Education Specialists. A lot of what we had done, we didn't give up on. It became another Zoom call. Unfortunately, it had to become another Zoom call. And going forward, probably we'll keep that hybrid model. I think the same way that Lions Clubs may well keep that hybrid model. But we learned something that we didn't expect in the process because we were forced to look at it that way. We can now bring world-class experts to anybody, anytime, anywhere on a computer screen. And we can continue to use that opportunity as we go forward. But the development that we did was how do we get people back in a room or in contact with the resources that we have? How do we get them back in touch with the Lions Club? How do we get the Lions Club back in touch with the certified diabetes educators, the doctors, the endocrinologists, the people who work with the patients day to day? How do we get Lions Clubs and Lions directly in touch with people with diabetes to make a serious difference? The way we do that is very simple. We took some of the resources that already existed. These are available in the Lions store. They're about a dime a piece. They tell you what diabetes is, what some of the symptoms are, and there's a nice little spot here in the back where you can put information to contact your Lions Club. They go very nicely into a bag of a prescription that's picked up at your local pharmacy. If you give them to them, they'll use them. One of the other things we did is we want to take the chance to let people know they may want to go see their doctor. Take the pre-diabetes quiz. If you haven't taken this, I want to be there when you do because I want to see your face like I saw my face when I added the numbers up at the bottom. These are the things that we have an opportunity to do, and we can do them at that level because one of the things we found out too is when people heard the word diabetes, the first thing they thought of was a finger prick in blood, and they don't want to deal with that. Well, in New York, if you deal with that, I'll need First Vice President Sheehan to bail me out of jail But you can do it in Florida, and you can do it some other places, so there are a lot of things going on. We wanted to set up channels for people through service activities to be able to do some of these things. That's a beginner channel. An intermediate channel may be do the same things with your local health department, but expand that. They're looking for people like us to help them. Work with your local food bank. Put resource materials in there about, yeah, we're giving you this food, but we want you to understand why it's good food for you, not the kind of stuff that makes diabetes worse. Have a health fair with sponsors. You can also just simply have some kind, have a strides walk, but if you want to add a health fair, that's intermediate. Don't forget that we can advocate for people with diabetes as well. One of the last things you can do if you want to be in the, call it the advanced channel, become a lifestyle coach or become a certified diabetes paraprofessional. You're not an endocrinologist, but you're smart enough to interface with certified diabetes educators and Lions to make those resources more meaningful to people with diabetes.
Pastor Brown. Another question to you. Mm-hmm. You have been working to break down Lions' efforts in the field of diabetes education, prevention, and support into beginners, intermediate, and advanced categories. Mm-hmm. Why was this an important endeavor, and what impact has this had on what Lions are doing?
I think it's an important endeavor. I quoted a couple of statistics about the prevalence of diabetes in the United States. We're an international organization. Again, it's about 11% of our population that has diabetes, and an unfortunate percentage of those folks don't know it. Actually, the worst prevalence of diabetes is in low and middle income poor countries, where statistics from the CDC and the ADA and others tell us that it could be as high as 1 in 2 people in the world who have diabetes, be it pre-diabetes, type 1, type 2, or in some cases, gestational diabetes. This is a difference that we can certainly make. When I was here 3 years ago and I had the opportunity to have some conversation about this, one of the things that dawned on me last night is my friend over here will be the first one to tell you that it also is one of the #1 causes of deficiency in eyesight around the world. So it's a married cause to what we already do. And how has it made a difference? It's made a difference, and I'll relate back to what we've heard from the United Nations so far. Here in the United States and everywhere around the world where we've stepped out and we've screened people for diabetes, or now bring these resources to them, they know that we care. And it makes us better Lions because without going too far outside of our comfort zone, we become better Lions in the process. And really that's what we're here for. And I believe that's what the UN looks for us to do, is to be a good partner, correct?
Definitely.
All right.
Thank you, Gary. We all want to be better Lions. And where to start seems to be an important question for Lions, especially when it comes to causes like childhood cancer. PDG Holland, inspired by your family's own experience, you worked with your fellow Lions on a practical way to support families who are going through the challenging time of caring for a child who is fighting cancer. Can you tell us a little bit about your own family story and how you were able to partner with LCIF and St. Jude Children's Research Hospital to make this project happen?
Thank you, yes. My family's story is not a typical St. Jude's story, but it really did open our eyes to what families faced every day. When my son was born prematurely, my wife and I were given the experience of existing in a hospital alongside a sick child. with little thought to how we would occupy our time, our minds, and our lives. We were solely focused on our son's development, and it really wasn't until months later that we realized facilities in general are not equipped well to handle parents that are going to stay with their child long term and through the entire care process. Well, when a tumor was discovered on my 8-month-old daughter's cheek, I knew she was going to be okay. The hospital was world class. And my concern was not for her care. But while going through visit after visit and test after test, I thought, how could Lions make this a little more comfortable and a little easier experience for the kids? My daughter wasn't even a year old, but this was going to be a long-term process. How could her journey be easier? What about the kids that live the rest of their lives going to clinic after clinic to get treatment and care until they leave us far too early? What can we as Lions do to help these kids? So I spoke with the child care advocate down in the Peoria clinic, and we settled on gifts for the kids because every time a kid comes in for a poke or an uncomfortable procedure, they're provided with a gift or a gift card to kind of get them through to the next visit. But my district wanted to go bigger. We had just discovered that the new and emerging grant for childhood cancer had been released, and we decided to set a lofty goal. Once our initial fundraising goal of $10,000 was met, we pulled all the goals off, and we managed to raise a little over $20,000, and we received a matching grant from LCIF of just over $20,000, which we used to overhaul the educational and recreational resources available to the children and patients and families of both inpatient and outpatient clinics. From iPads to Chromebooks to sensory wall boards, activity boards, gaming systems, and educational dolls, we fundamentally changed the treatment atmosphere for these children and their families. During a recent follow-up visit with my daughter, I enjoyed seeing children play with these wall boards and game systems, and overheard one mother express joy and surprise that there was a laptop she could borrow while her son was going through his medical treatment. I've spoken with mothers of several young angels, children that this world has lost to childhood cancer. The pain and sadness will never go away. But before starting this project, I needed to know that what we were going to do was going to help. I needed to know that we as Lions were going to make a difference. Every person stated that the long days of sitting and waiting were probably the hardest part of the treatment, and occupying time just made everything more difficult for the family. At the hardest point in the life of a parent, family, and friends, as the safety net for these children that will eventually be supporting the physical and emotional health of these friends, of recovering children, we can provide comfort and relief as Lions. This safety net must be made strong, maintained well, and respected because they carry forward the observational treatment and emotional support of the hospital staff. Everything we've done for the patient was done with family in mind. We must support the communities where these young warriors, for these young warriors, to allow them the chance to fight. And that's why we did this. On a side note, my 6-year-old son and my 5-year-old daughter are both happy and healthy and really anxiously awaiting me to come home. And they truly love being part of Lions.
What a fantastic story. And follow-up, PGG Holland, where can Lions start? And how about the rest of our panelists? How can Lions start? PGG Holland?
Honestly, the first thing we need to do is become educated, be open to ideas, and listen to professionals. Like I've said from the beginning, I am not a medical professional by any stretch of the imagination. But through this process, I leaned on the knowledge of those that had it, and I worked with them hand in hand in order to provide an experience for families and patients that was going to not only be beneficial, but long-term and, sorry, got choked up, but be beneficial for the long term for everyone involved.
Thank you. What about you, Gary? One Gary.
One Gary. AB, okay. Alphabetical.
Gary A.
Yeah. You know what? everybody, whatever age, whether it's our young people, our Leos, our children, our grandchildren that are helping us or want to help us, Lions, we're each good at something, okay? I'm not good at being a treasure. You don't want me to do that. We're good at something, and when we talk about vision screening, there's something that everybody can do, okay? You might not have a steady hand to hold a machine, but you might be good at recording something, or helping move crowd control, or paying attention to somebody who's a little bit anxious and keeping them happy. So everybody has the ability to do something, and once you do something, and once you see that here's a referral, and you find out that what happened with the referral and it was taken care of, you have that feeling that President Douglas did when he delivered the food. You made a difference in her life, and that's it. And that's, once somebody has that, they're a lion. They might not have their pin yet, but they're a lion.
Gary B.
My taller brother.
You got hair.
I do. I'll let you share some if you want. Go to lionsclubs.org, start your service, scroll down, and you will see all of the initiatives there. And a lot of the work has already been done. How can we start? What resources are out there? What can I do? The thing that I tried to impress on you is it's this simple, or you can go out and get trained to be something and put in an 18-hour course and make yourself the intermediary between your Lions Club, your district, your zone, or your multiple district, and the people who can make a really strong difference. One of the things I forgot to tell you is that 65% of the people who are diagnosed with diabetes never get any training with a certified diabetes educator. None. If you intervene ahead of time, you can cut down on complications. I think that's extremely important. And while you're on LCI's site, go to LCIF and look up diabetes grants. We actually want to help you do this. And the last thing is this: if you're afraid and you have no idea, see me afterwards. We'll talk.
Mr. Queipo, can you tell us where Lions should start?
Well, don't wait to be invited to do something good, and just have the initiative yourself. I always say, particularly to young people, to your Leos, but all youth, services start at home. It's a true leader is not born, but is made through education, the environment, in a family household. Something as simple, I was saying yesterday, as doing the dishes, make your bed, help with the chores at home, help your neighbor. That is true service. That is where it's born. And then from there you can start expanding. You shape yourself as a leader and as a service leader by serving others. And I have had the fortune and blessing of working for the United Nations for 14 years. I've met great global leaders and all the kinds of leaders that are not great global leaders. And the trait that I have seen always in all the good global leaders, that they're amazing people in the households, with the people they interact with, how they interact with the janitor, how they interact with the waiter, how they interact with the prime minister is always the same. That kind of behavior is one that you can see that it comes from a household where they really serve. So a true leader, global leader, it's impossible that someone can serve millions of people they have never met and they will never meet if they're not capable of doing the same for the people they love and they're close to. So find ways that you can serve at home and then start expanding your neighborhood, your community, an association, your municipality. You, again, will make a huge difference. And as Melissa said before, and we have said before, one person, everyone matters. The beautiful thing about Agenda 2030 is that says leaving no one behind. It means literally no one. So if we can be partners in that, in leaving no one behind, if you can, as Leos and as Lions, serve others, then we'll be accomplishing a lot.
And Mr. Queipo, Lions Club have existed for more than 100 years. And during that time, we have continued to evolve and meet the needs in new ways. Lions and Leos have embraced social media. to increase our reach? In what ways can we further utilize social media to help more people in need?
Social media is a tremendous tool. It is, I think that if you're not part of the conversation, you're missing a lot and you're not contributing. I think the secret for successful social media engagement is listening more than talking, is getting a sense of the conversation that is taking place, finding the needs of people, finding what is that they're saying, what are the necessities, what is that they really are yearning for, and then see how you can contribute through your efforts. I said before, the UN in 1945 was designed and shaped in a specific way to address certain geopolitical issues. The UN in 2022 has new geopolitical issues and new issues that are not so geopolitical but more ideological. You cannot fight ideas unless you address ideas. You cannot fight ideas with military intervention, with sanctions, with resolutions. That makes no sense. That aspect of the UN is reserved for specific issues. The UN in 2022, I think, is a three-pillar UN that finds the ways to serve through education, communication, and diplomacy. Educating people about their rights, about the capacity they have to make a difference, communicating effectively through all means, including social media platforms, and then finding quality diplomacy through great leaders who really care about people and who really care about serving others. If we can accomplish that together, if we can make sure that we create safe spaces in social media where we can really inform and build individuals and communities, that will be fantastic. One of the main challenges today is misinformation and disinformation. The challenges of, I get something from a friend on Facebook, I see something on Twitter, and it seems okay, let me share because that sounds so cool, or that sounds like, and we don't check whether or not, we don't verify whether or not that is accurate. The UN had to launch a campaign called the Verified Campaign, Shared Verified, because people were losing their lives due to misinformation on COVID-19 and vaccinations. And for that, this has a double edge because it's dangerous. Social media, if we don't control it, we don't have the self-control of knowing what we are replicating or redistributing. But it could be a tremendous tool to advance. Not everyone has access also to social media. And in regions of the world that need it the most, they may have text messaging, MSM, or they may have WhatsApp, but they don't have Facebook because of the bandwidth. Be mindful also when you strategize in how you're going to communicate of the needs of the people you serve and what they need, not so much what you think they need. And again, listen before you contribute, because sometimes you will be surprised how much we get it wrong. At the UN, we have learned, oh, they need, no, listen. Ask first, and then you will see, oh, well, we got it completely wrong. Because we are not there. Again, I will emphasize this. You as Lions, as Lions and as Leos, the role that you play in this effort, I think I've said it before, the UN needs you much, much more than you need the UN, because we really rely on you to reach the people that otherwise will not be touched. So again, strategizing, let's work together on that.
Thank you. Yes, certainly social media is important in the right way. But did you hear what you said so many times? Information, communication, education. ICE. ICE. ICE is the key to success. Coming from Iceland, you know? Remember that only. ICE. That's all we need. Correct information, correct education, and then we communicate. Well, to everyone here on the panel, we have several young people here today. Many of them are Leos, who are starting their service journey and make their impact in their communities. I'd like to know your thoughts on what young people today can be doing as they think about how they can make a difference. Gary, do you have an idea?
Similar to what I said before, get involved. You don't have to have any training. You just have to have the desire to do it. And back to just vision, you know, we can do that. You don't have to have any special talent, just a desire, and you'll make a difference.
You make a difference. Gary B., anything to add?
I said be unafraid when we had our practice session. I'll say it again, be unafraid. Step forward. We could do for diabetes what we've done for vision. and we can do it on your terms. Teach us how. We'd be happy to help you and share what we already have and listen to what you have for ideas to move it forward.
Thank you, Gary. Anything to add to that?
Be mindful. I think that young people need to be aware that other people's experiences are different, that sometimes, particularly the young people in schools and high schools and middle schools, they have peers that are going through tough times, and mental health is extremely important in addressing and serving other people. Sometimes they're not visible. There are disabilities that are not visible, visual disability disorder, they're not visible because we don't see them. They go inside. Be mindful of that, and then understand that you may play an important role in addressing those issues, in helping and supporting people. When you see someone alone, make sure that you don't contribute to bullying, but when you see someone alone, someone who's a victim of this kind of behavior, ensure that you're part of the solution, you're part of the supporting mechanism that they may have, because it makes a huge difference in someone to know that they're not alone. We have way too many teenagers committed suicide in this country for different reasons and around the world. We can stop that if we, from the beginning, if young people can understand that they don't need to wait until tomorrow to be leaders. They can be leaders today, immediately, to the classmates and to their friends.
Thank you.
Can I add one more? Young folks have some talents that we don't have, okay? And I get trained all the time. So if we're open to it, us old folks, don't be afraid. Show us your talents because you've got them, and teach us.
Yeah, there's a lot we can learn. And we have learned a lot during the COVID. For our last question, I'd like to ask everyone on the panel, what habits, considerations, and/or steps would you recommend to those who want to get more involved in improving the health and well-being of others? Gary is starting.
I get to go first this time. I get to go in front of A. What habits? I got this question a lot when I traveled around as a director. Why do you guys have given us, 5 initiatives and you expect us to do something in each one of them? And the answer was, I don't think we did. Pick the one that really turns you on, or the one that is most needed in your community, and jump on that. And like I said before, we have a lot to learn. One of the things we're doing here in New York is we've applied for a multiple district diabetes grant. Do you think I'm going to put that Facebook page together? Are you kidding me? But as we put it together, we want to build on what we've learned. But our representative from the UN used a term that I love to hear: listen. And those of us who have been around doing this for a while really need to listen. You can listen to what we've learned, but you got a lot to teach us.
Would you like to add something to what habits, considerations, and or new steps would you recommend to those who are starting the new service journey?
Absolutely. One of the biggest things we need to do is be willing to partner with people, be willing to listen and be open to other ideas. As an Eagle Scout myself, I learned that you have to be willing to work with those that are able to help you with a position, able to help you with a job. If someone is going to delegate, be willing to accept that delegation, but also be willing to step up into a position of leadership. It's important to be willing to say yes if you're expecting others to say yes as well. It's hard. It's hard to ask others to let loose of their hard-earned dollars, let loose of their hard-earned time, what little time they have available. And I can tell you from experience, as a blue-collar father of 2, time is precious. So before you say, hey, it's only an hour, it's only a weekend, be very aware of what kind of time commitment you're actually asking of someone. And that's another thing. Be very, very cognizant of how time management works. If a meeting can be accomplished over Zoom or in an email, do it that way. Service is important and getting together is important. But again, be respectful of everyone's time. And I would also like to thank President Douglas Alexander for the invitation he extended last night. The person I brought with me is my sister, Tanya, and I've bothered her a little bit here and there about becoming a lion. And she actually told me today before this started, you know, I'm going to become a lion. All right. So Leroy and Brian and Gudrun and Gary and everyone's saying, hey, you should become a lion. It worked, but she wants it done this weekend. So just so you know.
Thank you. Mr. Queipo?
I think that goes back to just, making service a habit. I think that in everything that we do, I want to the young people, I mean, those of you who are a little bit older, I still consider myself young, I'm 40, but for those who are a little bit over, it's a little bit late for this, but when you're thinking on your path, on your professional career, on your future, find a way to focus on service more than on making money. Sounds very idealistic and cheesy, but my mom always said, everyone except for thieves and assassins are important and necessary in society. My mom, she cleans offices in a university. My dad, he carries luggage in a hotel, and I am the person that I am because of the values that they instill in me. And what they told me is, whatever you do, whatever company you work for, work as if the company was yours. Whatever you do, always do it so that you can put people first ahead of you. And then blessings will come in the form of financial stability. But the satisfaction, I always say, I work at the UN. I will not become a millionaire anytime soon, that's for sure. But I sleep very well at night thinking that we make a difference in the world. And we have amazing partners like you that we can really make a difference for people. So if you focus your future career for young people on serving others, be it a driver, be it a janitor, be it a lawyer or doctor, it doesn't matter who you are, become the very best version of yourself. Always, it's impossible to achieve that if you don't do that through service, but when you do that, the satisfaction will by far be much greater than any monetary retribution that you may get for that.
What a great message to us Lions from UN. And with that, we conclude our panel discussion. This has been a great pleasure. Thank you so much to my fellow panelists for your stories and insight, and to everyone here in the room for your engagement and questions. Thank you all.